The wellness world is really good at one thing, getting you to spend your money. And most of what it sells you does almost nothing for how long or how well you'll actually live. The IV drips, the 30 supplement stacks, the detox teas promising to flush out toxins that your liver actually handles for free. That's money you'll never get back. But the things that actually move the needle, most of them aren't flashy, and most of them cost less than the gadget on your wrist. So in this video, I want to show you 6 places where your money actually buys you years, healthy years, ranked from the simplest one you can start this week to the ones most people never think to spend on at all. And this is not meant to be a shopping list, and I don't want you walking away thinking that you have to buy all 6. I mean, in the ideal world, yes, everyone would, but we're all working with a budget. So as I go through each one, the focus is going to be on how to prioritize. Which of these matter most for you right now and which ones can wait. Because the goal here isn't to do everything, it's to make sure that the money that you do spend is money well spent. And if you're new to this channel, I'm Dr. Kim, and my mission here is to give you the science and the practical tools to not only live longer, but to also feel better today. And as always, this video is educational only and not medical advice. So let's get into it. All right, so let's start with the cheapest thing on this whole list, and it's a home blood pressure monitor. Here's the situation almost everyone is in. You go to your doctor's, and then a medical assistant will wrap a cuff around your arm, and the machine will beep, and that one number that we get becomes the story of your heart health and your vascular health for the next year. But the problem is that number is very often wrong. And I made a separate video on why the blood pressures that we get at a doctor's office are often misleading, and I'm going to post a link to that below. But blood pressure is not a fixed thing. It moves all day, up and down, and it goes up when you're stressed, or when you've been talking, or when you rush to make an appointment, or when your bladder's full. It could also be inaccurate when your legs are dangling off the table instead of flat on the floor. There's even a name for part of this, and it's called white coat hypertension, where your pressure spikes just from being in a medical setting. And the recent estimates are something like 15 to 30% of adults whose blood pressure is high in the office are actually normal at home. And the reverse happens too. Some people read perfectly fine at a doctor's office, but they run high everywhere else in real life. And that's called masked hypertension. And it's the dangerous one because nobody catches it. This is why the US Preventive Services Task Force recommends confirming the diagnosis of high blood pressure with out-of-office readings before starting medications. And the deeper point here, the one that's gonna come up again and again in this video, is you don't want a snapshot, you want the trend, because that's more accurate and represents real life. So who should spend money on this? Well, honestly, almost everyone. It's relatively cheap, 30 to 80 bucks for a decent monitor, and especially if you're over 40 or if you have any family history of high blood pressure, or if you have any metabolic issues like prediabetes or abdominal fat. And it's also useful regardless of age if you've ever been told that, hey, your blood pressure is just a little high, we're just gonna keep an eye on it. This is the group that often slips through the cracks. The only people for whom this is not a high priority is someone who's young, under 30, with no risk factors and rock solid readings every single time. For everyone else, this is the highest value few dollars on this entire list. And if you are gonna get a monitor, just make sure you get a validated upper arm cuff that is the right size for your arm and not a wrist one, as I've yet to find a wrist monitor that is consistently accurate. Now, blood pressure isn't the only number where a single snapshot can be misleading. The exact same trap shows up with blood sugar, with a twist that actually surprises even a lot of doctors. You know the feeling of an energy crash an hour after lunch, the healthy meal that leaves you foggy, or the food that everyone swears by that just doesn't sit well with you. This could all be related to your blood sugars, and this is where a continuous glucose monitor or a CGM can definitely help. So a CGM is a small sensor that you wear on the back of your arm. It reads your blood sugar every minute or every 15 minutes, day and night, and it sends data to your phone. It was initially built for people with diabetes, but as it turns out, it's also useful for people without diabetes, for somebody who has prediabetes or any kind of metabolic syndrome features like high triglycerides or abdominal fat, or high blood pressure. And honestly, it could be useful for anyone who just wants to actually understand their own metabolic health. Because here's the thing, we talk about food like it does the same thing to everyone. Good carbs versus bad carbs, high or low glycemic index carbs. And that holds up for the most part for many people, but our bodies do not read nutrition labels. And how we respond to different foods is different from person to person. There was actually a study published in Cell where they followed 800 participants and they measured almost 47,000 meals. They gave the people the same standardized meals, but the blood sugar responses were all over the map. One person spikes hard on a banana, but their sugar stays flat after eating cookies. And the next person, the complete opposite. So same food, but completely different responses. And the reason comes down to so many different factors that make up who you are as an individual. So it could be your genetics or your microbiome, your muscle mass, and it could be your hormonal status like in perimenopause or menopause. And this is exactly where CGM earns its place. It can show you in real time which of the foods that you're eating spike you and which ones don't. Not the average person's, but yours. And of course, it's not just about spikes. You also get data on your mean glucose averages and how long you're in range and your overall glucose variability. So who should consider spending money on this? Well, it's worth it if you have prediabetes, or if you're carrying excess weight around your waistline, or if you have a strong family history of diabetes. And it's also worth it if you're the kind of person who will change how you eat once you see it happen on the screen. And this is not something you wear forever. The way I personally use it, or the way I tell my patients without diabetes to use it, is to just wear it for 2 to 4 weeks. You learn your patterns and then you stop. And then you repeat it again every 4 to 6 months or so. So you just use it as an experiment and not a lifestyle. And you can buy one over the counter now without a prescription. In the US, the two most popular options are Stelo and Lingo. And I've personally used both of them, and there's pros and cons to each one. If you want me to do a full comparison of the two, let me know in the comments, and I'll make a separate video on this if there's enough interest. Okay, so far we've covered two numbers that can mislead you, but here's the most misleading one of all, the one on your bathroom scale, and it's your weight. And one thing I repeatedly tell my patients is, your weight tells me almost nothing, because weight is muscle and fat and bone and water all mashed into one number. So two people can weigh exactly the same, but have totally different bodies and totally different metabolic profiles. What actually matters beyond your weight is body composition, how much muscle you carry and how much fat, and above all, where does the fat sit? And we also want to know how much visceral fat is there, that deep fat packed around your organs. This is the dangerous type of fat that I always talk about that pumps out inflammatory signals, and it drives insulin resistance and pushes up your risk of heart disease and cancer and even dementia. In fact, people carrying a lot of visceral fat have a 44% higher risk of heart disease and a 43% higher cancer risk adjusted for BMI. And that's the whole problem with BMI actually. It's just a ratio of your height to your weight. You will call a muscular athlete as having obesity, and it will completely miss a thin person carrying a lot of visceral fat. So the way you actually see what's going on the inside is with a body composition DEXA scan. It uses the same low dose x-ray as a bone density scan, and it takes just a few minutes, but it will give you a real breakdown of your body composition. So who should spend money on this? Well, it's important for everyone, but especially for anyone on a weight loss journey. Because some weeks you're losing a lot of weight, but other weeks the scale barely moves, and that can get pretty discouraging. But underneath, your body composition is shifting. You could be dropping fat and holding on to muscle, and the scale will never show you that, but a DEXA scan will. And this is especially important if you're on a GLP-1 medication like Ozempic or Wegovy or Zepbound, because these medications are so powerful, it's very helpful to get the body composition data to tailor your dosing and your nutrition and the type of resistance training you need to be doing to preserve your muscle mass. All right, number 4 surprises a lot of people, but I personally think it's one of the best investments you can make, is finding and seeing a good physical therapist. People tend to go to physical therapists at exactly the wrong time. We usually think of physical therapy as something we do after a knee injury, or after a bad shoulder, or after a back that finally gives out. But the real value is before anything is broken. As we get older, what derails a lot of people is not motivation, it's injury. One bad disc and you're out of commission for months. And months on the couch at 55 costs you muscle and bone that you don't easily get back. And most injuries aren't random. They come from weak links that you can't see in yourself. So things like how you load a squat, or a hip that doesn't fire, or an old compensation that your body's still working around. A good physical therapist will help you spot those weak links before they break. And this prevention piece isn't a hunch here, it's some of the most studied work in sports medicine. So there was a large meta-analysis published in the British Journal of Sports Medicine where they pulled results from over 26,000 people, and they found that proper strength training can cut injuries to less than a third, and they can cut overuse injuries by nearly half. So who should prioritize this? Well, ideally everyone, and ideally before we get hurt, but especially if it's been a while since you've really exercised and you're getting back into it. Because past 35 or 40, the body changes pretty fast, and with the hormone shift, the tendons and joints just don't bounce back like they used to, and you're just more prone to injury than you were at 25. And we especially see this in women in not just menopause, but perimenopause, because estrogen is protective for muscle. And once estrogen levels start going down, that will affect how our muscles and tendons and ligaments repair themselves. And unfortunately, it can make them more prone to injury. So what we want to avoid is jumping back into an exercise routine with bad form, because that's how you can get hurt in week 2 and quit for a year. At a certain age, proper form is not optional anymore, and injury prevention becomes one of the most important goals. The way I look at getting established with a good physical therapist that you can trust is like going to the dentist for a cleaning to avoid a root canal down the road. Because this is not just for athletes, this is for anyone who still wants to be active and hiking and picking up their grandkids at 85. All right, number 5 is finding a good primary care doctor, but a very specific kind called a direct primary care or DPC doctor. Because here's the real question hiding under this whole list. Who's actually keeping track of all of it for you? Who reads your labs beyond the surface level and thinks about preventing problems instead of just reacting to them, and treats you as an individual instead of a number? And for most people, the honest answer is nobody. And that's not your doctor's fault, it's the broken system that they're trapped in. A typical primary care doctor carries a panel of 2,000 to 2,500 patients, and there was actually a study that ran the actual math on doing everything the guidelines ask for a panel that size: the prevention, the chronic care, the paperwork, answering messages. And that number came out to 26.7 hours in a day, and a day has 24. So your doctor is set up to fail even before you walk in. And that's why a physical can feel like a 10-minute checklist, not because they don't care, but because the system gives them no time. So the fix a lot of people are moving to is DPC, or direct primary care. It steps outside the insurance system entirely, and you pay the doctor directly, usually a flat monthly membership fee. And that one change flips everything. No insurance billing means a clinic doesn't need to hire a whole office of people just to fight insurance denials and delays, so the doctor doesn't need thousands of patients to stay afloat. The typical DPC doctor's panel size is usually anywhere from 300 to 600 patients. And having a panel size that small gives them back the one thing that the system took away, and it's time, which can translate to longer visits and easier access, and a doctor who's deeply involved in your health as opposed to running a checklist set up by an insurance company. And here's where that monthly fee starts to pay for itself. A lot of DPC clinics negotiate cash prices for labs and imaging that are a small fraction of what they would cost if you ran them through insurance. And I've seen a cholesterol panel for $6 and an A1C for $4 and a basic blood count for $3. And same with imaging. Cash pay MRIs far below the hospital price. And some of these clinics are able to get your everyday medications at wholesale. They just cost a fraction of what it would cost at a regular pharmacy. And you might be thinking, but I have insurance for that, and that's exactly the point. With the way premiums for insurance have been climbing for the past many years, and nowadays almost everyone is being pushed onto high deductible plans where you're paying full price out of pocket until you hit the deductible. So in a lot of these scenarios, paying a monthly fee for DPC providers you'll still come out ahead. And who's it for and who should prioritize this? Well, honestly, almost everyone, especially if you miss that old school relationship with a doctor who actually knows you and picks up the phone when you call. But the one group where it's not as high a priority is if you're young and healthy and if you rarely need care. And by the way, this is not a paid promotion. There isn't some big DPC company behind any of this. It's just thousands of independent physicians across the country, each of them running their own practice. I just think that this model deserves a lot more attention, and I recommend this to my family and all of my friends. All right, and number 6 is the simplest thing on this whole list, and that is spending a little bit more money to sleep better. And here's why I saved it for last. You can buy every test and see every doctor and build all the muscle and eat nutritious foods, and short broken sleep undercuts all of it. Because sleep isn't wasted time, it's the time when your body does its repairs, and it's the time when your brain does something kind of amazing. Every night it opens up a built-in plumbing system, your lymphatic system, that basically washes itself, and it flushes out junk that builds up during the day, including the very proteins linked to Alzheimer's. But if you cut your sleep short, that cleanup process never finishes. And this is why one rough night can leave you foggy, and years of them can do something far worse. So it's definitely worth it to spend money on a genuinely good mattress, since you spend a third of your life on it. And then it also helps to have blackout curtains, because even a sliver of light can tell your brain to stay awake and disrupt the quality of your sleep. And then it helps to get bright light in your eyes first thing in the morning to set that internal clock. But none of that matters if you don't protect the hours first. And for most of us, sleep is the first thing we sacrifice. There's always one more email, or one more deadline, or one more scroll, and staying up late feels productive, like you're stealing time back from the day, but you're not stealing it. You're just borrowing it at a very bad interest rate. And then you have to pay it back the very next day with slower thinking and worse decisions, more cravings, and a shorter fuse. So protecting your sleep isn't lazy, it's the actual work. Treat your bedtime like an appointment that you don't cancel. And then set a hard stop on the day and get the phone out of the room, because no mattress on earth will fix sleeping 5 hours a night. That sleep discipline is the investment here. And the mattress honestly is the easy part. All right, I hope this was helpful. Stay healthy, and I'll see you in the next one.